Okay, so yeah, there is, as you probably know, there is a really nice fitness center at the Anschutz Medical Campus. There is a fee associated with that. And I don't remember off the top of my head what the fee is for students at this point. I think it's somewhere between $30 and $40 a month. We will be inviting a representative from the Wellness and Fitness Center to come to orientation. We'll do a table session during that week, and you'll be able to connect with resources there. But my understanding is that only extends to the Anschutz Fitness Center. Our students at Anschutz typically are not the resources at the downtown campus are typically not accessible to Anschutz students. It's based on student fees and distribution of those fees. And Kelly, I don't know your question about having access to the Wellness Center at CU Denver for alumni. That may be true at the downtown campus, but I don't believe it's true for anything at Anschutz. So Stefania's got a question about the schedule. And so her question in the chat is about the overall schedule for the program. Will there be breaks between semesters? How long? I mean, there are typically some small breaks during the semesters in terms of the didactic classes, but as Dr. Bowler mentioned during her session, there could be clinicals that are assigned during those class breaks. So it's very difficult to kind of plan. Like if you're trying to go on a vacation during a class break, there's the potential that you'll have clinicals. So what we typically recommend is for students to buy refundable tickets, purchase hopefully cancellation insurance if you had to, return. I mean, we've had students have to return from a vacation because they had a clinical that was assigned. So we just always want to make sure we're very transparent with students about that. So I see a couple of hands up, and I'm not sure if they're up for me now, if they were lingering from before. So I see Bria, you've got your hand up. Is there a question that you still have that I can help with?
Okay, I'm just trying to navigate, and I can't find where to navigate the cough thing, and I just can't find where to authorize it.
So I would say if you're having a difficult time with that, there is if you Google CU Anschutz College Opportunity Fund, there's a whole site on cough. And I would imagine it will tell you kind of where in the portal to navigate. But if you can't find it, send me an email, Bria, and I'll send that cough link to you.
Okay, thank you.
Sure. And I can see Emily and Jordan also have their hands up.
Yeah, I just had a kind of follow-up question about the comment regarding clinicals and breaks. I know that Dr. Bauer was saying that we use 4th of July, Memorial Day, those kind of things. My question was more surrounding Christmas. So I'm not planning on leaving, but my family is going to come here. And I'm just wondering if there's a given amount of time that we could plan to be gone, or it's not really something we know until we were in that semester.
Yeah, I don't want to tell you the wrong thing because I don't know if there's a guarantee as to when you will not have the potential for clinicals. So I would imagine that will be addressed when you start, at least if you're thinking about this coming winter, when you start med-surg, which is in block 2 of fall, and everybody takes med-surg in block 2 of fall. Your faculty will likely talk about those potential timelines for that winter break clinical.
Gotcha, thank you.
Sure. So there was a question in the chat about, and it's not a silly question, don't worry about that, Anna. Is there a particular dress code for the classroom? I would say, I would typically, if I was a student, I would probably, you want to be comfortable because you're going to be sitting in a classroom for multiple hours. And I would also dress in layers because, as some of you know, if you've been on our campus, the classrooms can be really cold and sometimes they can be warm. So I would say, bring multiple layers, but if you think of kind of a business casual type of dress code for the classroom, I think that's appropriate. And then Kelly had a question, are the clinicals always 12 hours or do they range? I think a lot of times they are 12 hours, but it kind of depends on the clinical partner and what the clinical is. They could be, I think, somewhere in the range of 8 to 12, but I would say you're probably going to find mostly that they're 12. Okay. So I can see that Maxine Lomax has joined us. Max, thank you so much for being here. We'll get started at 11. Some of the students may have just jumped off Zoom for a few minutes to take a restroom break.
No problem.
So we'll come back in just a few minutes. Thank you so much for spending some time with us today.
Thanks for inviting me.
Of course. Are there any other general questions in the next minute or so that I can help with?
Yes, I have a quick question. Can I
Sure.
go?
Carolyn, why don't you go first, then Amanda will get to you.
Okay, I noticed that in the course outline, we don't have a MedSearch 2 anymore. Was that taken out?
MedSearch 2 is also called complex care.
Oh, complex care.
Mhm.
Okay, thank you.
Sure. Amanda?
Yeah, this might have been a better question for Joe, so if you can't answer it, don't worry.
Okay.
In terms of looking at our aid history, I've been looking at the FAFSA website or the My Student Aid. I haven't been able to see it, but I know that I used some federal aid when I was a dependent, and when I became an independent, I used some too. Are those separate categories completely, or is there overlap between independent and dependent loans?
That is definitely a question for financial aid.
Cool.
On that handout, I'm not looking at the handout at the moment. I'm sure she's got the financial aid email. There's a general link for our general email address. It's fin.aid@cuanschutz.edu. Just shoot that question over to them and they'll be able to help.
Great, thank you.
Sure. Okay, so I think we're going to go ahead and get started. So Max has joined us today, and she is an access coordinator in the Office of Disability Access and Inclusion. So Max, I am going to turn it over to you. Thank you so much for joining us.
Hi, everyone. Thanks for having me. So I want to talk to you today a little bit about the Office of Disability Access and Inclusion, who we are, what we do, our processes, and how you can maybe get in touch with us and hopefully have some time to answer any of your burning questions. So who we are a small team within Student Affairs. Right now, it is myself, Maxine. I'm an access coordinator. We have my colleague, Sarah Gyrie. She actually just joined us about 2 weeks ago. And then we have our director, Lauren Fontana. And together we make up the ODAI team. You'll probably have most interactions with Sarah and myself for intakes, proctoring, and things like that I'll get into in a bit. So what we do, overall, the Disabilities Office is responsible for determining and supporting implementation of accommodations for disabilities. We support disabilities such as ADHD, anxiety, depression, so more things like learning disabilities in terms of reading, dyslexia, but even chronic health, whether it is maybe diabetes, Crohn's disease, things like that. Accommodations extend to both the classroom, the academic setting, as well as clinicals. So what we do, what mostly Sarah and I do, is we meet with students to determine accommodations. We review your documentation, and then we determine what is most reasonable and appropriate. And I say reasonable and appropriate because sometimes they aren't. And what we can't do, the one thing we can't do is alter the fundamental nature of a course. So if there is a course requirement that maybe you're having some trouble with, we can see how we can accommodate you in that way, but sometimes we can't take it away or change it too much, because then would really change the curriculum and the education that you are receiving. One big thing we do in our office is proctoring exams for students who maybe have an extended time accommodation or a reduced distraction, we call it, would come test in our office. It is a lot quieter, maybe fewer people. So that's where you'll probably see Sarah and I a lot, is in proctoring some of those exams. So how do we do this? What is our process like? We require students to complete something called an access form, and that's you as a student, it's your opportunity to kind of self-disclose your disability, answer a few questions. You have time to review them and see, you know, actually, what do I feel here? What do I experience? And that's like your initial communication with our office. Say, hey, I am a student. I identify as having a disability. I would like to talk to you, reach out, more information, see what we can do for you. Then we do require supporting documentation. This looks different depending on diagnosis, so I won't go too much into it now. But supporting documentation, essentially, that speaks to your diagnoses, but more so your experience with that diagnosis, you know, what your limitations are, your barriers are, and from your provider, what they recommend we put in place to accommodate you at Anschutz. And then lastly, students are invited to meet with an access coordinator, again, Sarah and myself, for an intake. And that's our opportunity to learn a lot more about you more in depth, because you're more than, you know, what your doctor has said about you. You're more than what is in an access form. So we just want to have a conversation with you and see a little and hear a little bit more about what you're experiencing. So then students who are approved for accommodations will receive something called a faculty notification memo. Accommodations will remain in effect for the duration of your program, but every semester you will be responsible, you'll hold on to that. At each term, at the start of the term, you'll be responsible for sending that to your faculty to say, hey, I have accommodations and I would like to use them. Here's what they are. And maybe that requires a little bit of a conversation with them. If it's something that you're not sure how to accommodate, how they may be unsure, we're also here to support the faculty and staff to better support you. So like I said, accommodations will remain in effect for the duration of your program unless something changes. Maybe you're like, hey, I actually don't need these accommodations, or maybe sometimes it's, I think I need other accommodations. I'm not really sure when I entered the program. I wasn't sure about what I would experience, what the program would be like, what these barriers would be like, what the courses, what the clinicals would be like. And I feel now that I need more accommodations. That's something we see quite often and something we can certainly help to accommodate. A lot of students say, well, I didn't have them before, like, is it too late? And I will say it is never too late to get accommodations. I mean, it could be the last 2 weeks of the semester. And if you experience a disability or something happens, whether it is hopefully not an accident while skiing or you've gotten hurt and you break your hand, we can support you, we can help accommodate you. The thing I will say is accommodations are not retroactive. That means that if you didn't have accommodations at the start of the semester and you've taken an exam or two and realized, oh wait, I feel like I do have a disability, something's going on here. I really feel like I need some accommodations. We can support you in, you know, getting those things set up and getting you accommodations, but we can't go back and allow you to retake the exam with the accommodations. Once accommodations are approved, we move forward with them. So I just was a little overview of kind of what we do. I want to allow some time for some questions. I will also put a link to our website and our email in the chat, just in case you do have questions or concerns and you're a little more comfortable asking them privately. Does anyone have any questions? So I can maybe answer some of our frequently asked questions. What do you accommodate? And that's everything, kind of the things that I said: ADHD, anxiety, depression, learning disabilities, but even temporary diagnosis. If you've gotten injured, I've had so many students need ACL surgery and require accommodations for that. Another one that I get quite often is, when should I apply for accommodations? As soon as possible, as soon as you think, maybe I do have, or I'm not sure, it's always worth a conversation to see if you would like accommodations, if there are accommodations that can be made for you. And like I said, it's never too late, but the earlier the better. We do promote getting in contact with us as soon as possible. Sort of. I see the question here, if accommodations are granted for the clinical or the academic setting, does it also transfer over to the clinicals? And it depends. So some of the accommodations, such as extended test time, like that's, kind of strictly like a didactic accommodation. If there is a clinical accommodation that's required, that would strictly be for like the clinical. There really typically isn't much overlap in one, like, let's say the accommodation is for overnight clinics. That kind of wouldn't translate to the academic because hopefully you wouldn't have classes overnight. So it really depends. I'm not going to say that we keep those accommodations separate, but students kind of reach out for them individually. It's like, hey, I need this for the academic and I need this for clinicals. And we can write the accommodations to be that appropriate for the academic side or the clinical. See if there are any more questions in the chat. So I'm going to put our email in the chat. You can go ahead and give us an email if there's a question. No, there are overnight clinicals, yes, and I believe your programs can speak more about that and what that looks like.
And I can just comment on that real quick, Bria. And I think Dr. Bowler mentioned this for the 12-hour health assessment clinical for this summer. You're either going to be assigned to a Saturday day 12-hour shift, an overnight, like a typically at 6 p to 6 a over Saturday night, or a Sunday during the day. And that extends beyond health assessment. So at any point in time, students could be assigned for overnight shifts. We do use a 24-hour clock pretty much for all of our potential clinicals. Are there any other questions for Max? Any other common questions that you get, Max, that you haven't covered so far?
Yeah, I was just thinking about that. One that I will say though, because I do recognize some names here, is that if you've met with us and you've submitted everything and you're expecting your accommodations to be in place, do not fret. Your letters will be coming in the next week or so. And anyone else who's curious, wants to know more to see, like, I don't know if I have a disability, should I reach out? Please do. Like I said, it's always worth having the conversation.
Okay, well, if there's no other questions, I mean, Max, you're willing, you're certainly welcome to stick around for a few minutes if anybody else has questions. But the next item on the agenda is going to be our question and answer panel with a few of our alums plus current students. That's going to get started pretty much right around 11:20. So again, we've got kind of another little break here, and if you want to just jump off for a minute, just make sure you're back, I would say shortly before 11:20.
All right, take care, everyone.
Thank you, Max.
Bye-bye.
"40 days away from graduating and being done. I am currently, I have a couple offers for nurse residency programs and I have a couple more interviews. So I'm getting in the process of getting myself set up for my jobs when I'm done. I'm currently in community health. I get to teach sex ed to 8th graders for my clinical. I've had a lot of success in this program. I also live in the mountains and work a couple full-time jobs. I work in an emergency room and labor and delivery as a scrub tech. I work in outpatient clinics up here in the mountains as well. So being able to manage that without the program and get really good work experience. So that's me.
I'm Sydney. I'm a current senior graduating in May, so I'm very excited. I'm currently in for multiple jobs. I have one on Tuesday. So I'm getting prepared for that. I'm currently in my senior capstone course. I'm in the CTICU. So very intense, but very awesome experience. Like Ashley said, just have had a lot of success in the program. Here to answer any questions you guys might have.
I can go. I'm Emily. I'm same with Sydney and Ashley in the same timeline, graduate in about a month. I am doing my capstone right now at Littleton Adventist Emergency Department, which is also where I work. And then I'll be starting there as a nurse in August. Yeah, it's been quite an adventure, but the program's been really great. Looking forward to talking with all of you guys and answering some questions.
I'll go next. Sorry, I'm currently at work right now, but I am same as Emily, where I both work where I am doing my current capstone at Littleton Adventist Emergency Department. It's been a wild, crazy morning, and it's been a good morning all at the same time. But yeah, this program has really given me a lot of opportunities, but have also challenged me at the same time. And yeah, I'm really excited for you guys to start your 2-year journey.
I'll go next. My name is April. I'm currently a senior like Sydney and Ashley, graduating in May. And I'm currently in our community health. So I'm teaching sex ed to 6th graders. Super excited to start that coming up. And I actually accepted a job over Christmas break in Knoxville, Tennessee in their neuro ICU. And I'll be starting that in July. So lots of chances for jobs. And this has been great for me. Excited for your questions, guys.
I'm Chantal. I graduated in 2019 from the traditional program, and then I went directly into my NP program to be a midwife, which I graduated in December. So I'm currently working as a midwife at Boulder Birth Center. When I was in my undergrad, I was president of CUSNA, so I really love being part of the student associations. I think that's super important, and I'm really excited to answer any of your questions. Congratulations on the beginning of your journey.
Hi everyone, I just joined and I'm kind of all over the place because my internet was out. Hi Chantal. I know, so we have history, I guess. I am also a TRAD 2020 graduating in May. I was also in Chantal's cohort, but I had dropped out. And so that's how we know one another. Yeah, same like Chantal, I was actually a vice president for CUSNA. I was director for Future Voices and one of the nursing work group leaders for Dawn. So I'm excited to have you guys here and happy to answer all the questions. Thanks.
Hey, I'm John. I'm a med-surg nurse on MedOnc at UCH. I also work at the Coalition for the Homeless part-time, and I graduated in 2015 from the UCAN, and then I worked in prison for a while, and then I decided to go back to the hospital system. And yeah, that's me. Next person.
I think we may have everybody. So I think, and thanks, John, and thanks Upasana, and thanks Lainey for being here. I didn't get to introduce you earlier. Same era, Emily, with you. So I think at this point we can turn it over to questions. I think there's some questions in the chat if you all want to kind of keep tabs on that. But do students want to just maybe unmute and ask questions to the group? That's fine too.
Yeah, I feel like that
all of
the
those
best.
questions.
Yeah, if you guys want to like just have a conversation, that might be probably the best for us, just so all of us can be able to kind of give you different points of view.
Yeah, I mean, we were in your exact spot, your position. And sometimes you're in this like position, you don't even know what you need to ask or want to ask yet. So we can like even just talk about like clinical experiences or like our schedules or like how we've been able to manage like work life stuff with it. There's a lot of topics I think we could cover or give you a little bit of insight.
Hi, I'm Sierra. I have a question. I would love to hear more about work-life balance. I have 2 kids and a job, and I'm a little nervous about balancing it all. So any advice or experience you guys have would be helpful.
Definitely having a big support system to rely on. I don't have kids, but I have a puppy that is my kid. And having people to like watch her while I'm at shift or at clinical or working. I'm part-time throughout this whole program. So I work 2 12-hour shifts a week at UC Health on the transplant floor. And then on top of that, having clinicals. So definitely having a good support system to rely on has helped me.
I will second that. So I'm a single mom of 3 kids. And it is really important to do that, and also to be very diligent in how you are putting together your schedule and when you're blocking in study times, and then being very also diligent in putting in time for time with your kids and self-care. I know that sounds like impossible, but it's really important to really be very structured in your time management so that you are being really effective. And sometimes that is understanding that studying is usually most effective in smaller chunks instead of these really long jags of studying. So being really diligent with making sure that you're being smart with your study blocks is, I think, very, very important. But it also is important to know that it's doable, right? That this program is very doable as, a parent to kiddos, and you can be very successful. You can even do extracurricular things as well as doing that. I was also in the honors research program when I was in my undergrad. So and it's not like I'm like amazing or extraordinary. It's just, it's very doable if you're very cognizant of how you're structuring out your time. So I guess the takeaway is that it's doable. And as long as
I second that for sure. I think we should, when you sign off Zoom today, go to your nearest drugstore or whatever and get a planner, because that is going to be your golden ticket to being able to manage everything. I think the first step is acknowledging and giving yourself the credit that you can do it. It just takes a lot of good time management skills. Like, I have a planner and it goes everywhere with me. And I even schedule time, like when I'm going to do my laundry, when I'm going to shower, because I can, with COVID and stuff, and we were on Zoom for quite a bit, but once we started getting back on campus, I actually have been commuting from Summit County, so up in Breckenridge. I also work multiple full-time jobs as an EMT, a scrub tech, and a medical assistant in different units at the hospital up by me. It just takes time, and I think you just need to go into it knowing that this program is your utmost priority above everything else. And everybody who is involved in your life needs to know that and support that, including work managers or, your kids' support systems. But I think it's just important before classes start that you get your mind frame around class, and this program comes first, and you'll be set up for success from there. But it's doable, 100%.
And I added in the chat, learn how you study. If you don't know how you learn, or if you don't know what your learning style is, it can be really challenging. But if you know your learning style, focus on that. It may not be lecture. And if you know that, understand that you may have to take more time if you're not really an auditory learner outside of class to absorb the information. So really understanding where your strengths in learning is and how you do it is going to help you do really targeted studying. And that may be that you study better in a group. And if so, establish these connections early on in your program so that you get this group of people that will come together and study together, remind each other of your assignments when it's due. That sociality, that is very, very important and can be really helpful in your goals.
100%. Me and Sydney actually met during one of our very first Zoom orientation sits. And I think our buddy system is what made us like find a best friend, find a group who is your, like, no one is your enemy. Everybody is your friend. You guys are all trying to reach the same exact goal. And when the sooner you realize that, the more you can work together and study together. I 100% would not have been able to get through this program with the success I've had without Sydney as my support system and my backup. Like, we have definitely, like, even when things have gotten rough and we're stressed and so much is going on, I can call her and she can vent and I can vent, and we know what's going on with each other and bounce stuff off of each other. It was just so important. So, like, look around and get a buddy ASAP.
We just got off one of those calls before this, so it really helps.
And get to know your medical terminology, your Latin and Greek roots, because I will say life is so much easier when you're like, oh, I know what this is because the word is telling it to me. I don't have to memorize anything. So really, if you get those fundamentals down packed and understand how those things go together, I will say, like, patho is so much easier because you're not memorizing a bunch of stuff. It just makes sense. If you understand just how things move in the body, that make the physics of it, life will be so much easier because you're not memorizing everything. It just makes sense. So make sure your foundations are very, very strong.
I also have to second that though, I've came into this program with nearly a decade of tech type positions and work experience in the healthcare field. And I have come across many situations where it has not helped me. It's actually hurt me. It's like when I do like NCLEX practice questions, I think of real case scenarios, not like perfect. And so I have to sometimes take a step back and go back to the textbook structured view and how to answer questions. So if you're sitting there and you don't have healthcare experience, do not worry. This program will take care of that. You might just have to have a couple extra study hours here and there to pick up on stuff. You might be Googling things in the middle of lecture, like, what did they just say? But never be afraid to ask questions, because the only way you're going to learn is finding out what you don't know and go from there. So work experience is not necessary to be successful in this program, but also this CU has this awesome ACP and they'll promote it a lot. But if you have opportunities to get like a PRN or like a part-time position in the program, it also just helps you make work connections and professional relationships to set you up for jobs later too.
I think setting your foundation, like the first 2 semesters of nursing school are rough because you are in multiple classes at one time. So definitely getting your study group, like learning patho down to the bones. Like, I think that set me up so well throughout the rest of like all like the specialized classes with like peds and complex care and everything. Because if you understand the patho of something, it really helps you learn like what interventions you might be doing, and all of this will make sense, I think, once you like progress throughout the program. But definitely like focusing on like patho, all those like basic classes that you're going to be taking at the beginning, it
like,
really sets a
build on each other, right? Like if you get patho down, moving into like your med surg class, it just starts to flow and everything starts to connect. You're almost going over some of the same topics, just in a different view. So like those first 2 semesters are 100% rough and chock full of information. You're going to feel like it's coming at you at 100 million miles an hour, but then things will start to connect and you'll connect the dots. But studying hard your first 2 semesters is crucial.
Some of the tips I would give is take advantage of your peer mentor. I truly relied so much on my peer mentor, and they were very they really redefined how I learned. And so that could happen to you too, and YouTube was my go-to. So don't be afraid to YouTube things. Be careful, obviously, who you utilize as your resource, but there are pretty good channels out there for nursing stuff. So, and like your teachers will also link those sometimes in the module. And the third thing is, if you do end up, like pharmacology, one of the biggest tips I guess I could give for pharmacology is studying like make a habit of active recall. That was the only way that worked for me. So that could work for you too. And it's a proven way to, boost your learning capabilities. So.
To go off of what you kind of said, I had a really, really tough time my first semester. I was crying all the time. I never felt like I was good enough. And I felt like, Patho was really one of my hardest ones. And some of the YouTube videos that I used was that nursingrn.com. Even though I'm not a big fan of her voice, but she she does a really good way of kind of like doing a good job of what CU teaches you. And she teaches you in a way that you can be able to kind of break it down and understand it after you've listened to your lectures, after you have taken notes. I think it's a pretty good resource.
I'm sorry, Amy, I'm just going to answer this really quickly. With the peer mentor, you're sort of randomly assigned. Your peer mentor will have everyone from the same color group. So it might end up that it's people in your same clinical group, but they'll have people who are in the same color so that everyone's going through the same classes at the same time. Sort of backing up what Usana said earlier is that the mentors really are important. I'm one right now, and I feel like I've talked a couple of my students off of cliffs just because those first 2 semesters are really hard. But it does get better, and having that person who's been through it and can very acutely remember what it was like is a great person to reach out to. Even if the skills that they have don't match with yours, they might know someone else in their cohort who has what you need for your particular learning style.
I think there's a lot of like pride when you're a nursing student, and it's important to maybe just check some of that at the door. Like, you're not a medical student, you're a nursing student. You don't have to be like the expert at the body, like, and know it like you had 10 years of medical school. Like, just like kind of keep that in the back of your head. Like, yeah, still get A's, but like you're not going to come out of this prepared like you've been in through your residency. So it's different focus. And as far as like leaving that pride, like I think like it was like hard for me to watch YouTube. Maybe the culture has changed in 6 years, but like I was like, well, this is not okay. But like there really is a lot of good info there. Also, like checking your pride as far as like asking your family and friends to like watch your kids. Like like just like you're not, you're not some Greek statue. You're like a human and you need help. And yeah, it's pretty normal.
Yeah, there's definitely a reality check. I mean, I had some work experience starting this program, but I found it the most helpful and created the best learning environments for myself by just shutting up, because you learn so much more. Like I might know how to start IVs, but seeing somebody else do it, you always learn something new. And I think just keeping your mind open and checking your attitudes and stuff at the door and just having that your eyes wide open and being open to learning new things all of the time has helped me grow exponentially, 100%. But I've also seen some of my colleagues kind of act a little too cocky, and then their preceptors or other nurses around like are not willing to teach them. So having the right attitude is definitely a huge factor of what you learn. I agree.
And you'll hear trust the process a lot throughout this program, and it's really true. Even if you're like, no, but it really is true. Just trust the process.
I'm still learning to trust the process. But I'm sitting here thinking about my orientation and like how far I've come these past 2 years. Like the weeks were long, but now I'm realizing like these years went by really fast. Like you will get there where you will have some nights you are studying and it's been, oh my gosh, I can't handle this. But I'm looking back like this went by so fast and I have learned so much. And this program I'm so glad I went to CU for sure. But I feel like the chat's blowing up. Does anybody want to ask any other questions or like speak out? Like you can turn on your cameras, like get used to Zoom University because this is not a thing that's going away. You don't have to be shy, even if your hair is all up in a bun and you just rolled out of bed. We all get it.
I would love to hear about like the sim lab. I'm so curious because I've never done anything like that. What was that like for you guys?
So weird. You just have to like buy into it and get like, it's funny and weird, but like you just have to like buy into it, and like it's the best. Like screwing up in sim lab is funny, you learn so much, but that doll like blinks at you and it like talks to you. It freaked me out.
There's just like a microphone that your teacher's on the other side of the glass, like acting like the patient. And there's like monitors and they can control it. So it's just kind of like figuring out your flow when you enter a patient's room. But yeah, it can get a little weird and funky. Like might have a mannequin that gives birth, like all that kind of stuff.
The sim labs that I actually really enjoyed, and I'm sure that Emily might agree with me, is the mental health ones where they had the actors come in and they like acted for specific problems like bipolar disorder or borderline personality disorder. Like these are things that I've never seen before, or I've like some of them I've never even met anybody with these types of disorders, and like they help you work through what to do when talking to these types of patients. I thought it was really rewarding. It was definitely very draining, but it was very, very rewarding.
I feel like those guys who like actually acted it out, I mean, some of them we even did over Zoom, and it was so realistic. It was really cool. So sometimes it's not just a doll, it's actually like people who will be your patient. Sometimes you'll like even be patients for like your study groups, learning your head to toes and stuff too. So it's cool. I like SimLab a lot.
Yeah, SimLab for me I didn't always love it. It's hard for me to separate myself from that not real patient versus real patients, but you really do just have to take it with a grain of salt. Like Lainey just said, like at least in our department, I mean, we're in ER where we see a significant amount of mental health patients. So even though you're sitting on a Zoom and someone's your teacher and it's not real, and you're just kind of like, oh, why am I doing this? Like, just try and make the best of it, because realistically, you're going to run into a patient like that and you'll be like, oh, okay, I did have some training on this. That did help me. I can now approach this patient the correct way. So they're a little awkward. I delivered a baby that was like covered in grape jelly or something. They're weird, but they're, it's a short blip in time, and just make the best of it when you're there, and you might actually use that in the future. So
one of the guys in my clinical group, he set out from day one that he was going to be in mental health. And over clinicals, it was very apparent that he's going to be a mental health nurse. He's born and bred for it. One of our clinical sim labs was about a patient passing and like, how do you deal with that with family members at the bedside? But like he took over this role, and it was just like this wave that went over him, and we all got to witness his skill at like calming the family member down and walking her through the process, and like creating this warming, comforting environment to walk through this death process. But in SimLab, we all get to be a part of it and see it too. So it was a learning experience, not only for him, but like us too. So like SimLab is the place to learn before you put your feet on any unit in the hospital. Definitely. I loved it.
Yeah, sim is great because essentially we're guaranteeing certain scenarios to come up, right? We're in the real world, we can't tell you, oh, you're going to see this kind of patient today necessarily. You're going to come across this event. But what's the beautiful about sim is we can say like, no, we're gonna make sure that you get this type of experience. Yes, it's simulation, but it does help you kind of work through your process of how you would approach it, see what you're naturally getting like drawn to. And then, yeah, it's a beautiful teaching learning thing because you get to observe, and then you have this beautiful built-in debriefing moment, which I think is very helpful, that we don't always get in the wild, right? That we don't get to like say like, hey, let's stop and talk about this.
Totally.
I think, oh, sorry.
No, go ahead.
I just like remember it was a long time ago for me, but I felt like I struggled to share the patient. Like I was like, there's like 6 other nurses, and like who does what? Like it made me mental, kind of just like you get to like listen to the lungs and I'm gonna be over here giving meds and the third person's gonna like assess the feet. Like this is not how nursing is. But like then you get out there and like it's totally you're sharing the patient. Like it's actually like a good practice.
Teamwork for sure.
So I think that Jennifer asked a really good question. And I think this is something that we should really talk about, because of the fact is like, I'm sure like many, they do know where they want to go and they do know where they want to end up. And then there's people like, I don't know, for me, example, I had no idea where I wanted to end up. I was really just taking every clinical experience where this may be possibly where I fall in love. And that's okay too. And I just happened to fall in love with the ER. But I think that, you know, when I was in med surg, I fell in love with med surg. And then it's like the little things that you take with it. But at the end of the day, you know, you just have to make that decision for yourself and like what really sparks that joy within you and what is like the demographic of the people that you want to take care of. But I think that was a really good question. And thank you for asking it.
Yeah, but also I think the beauty of nursing is that it's very fluid. You're never stuck to a certain specialty or a certain unit or a certain hospital. Like that's why I went into nursing, is because if I go into a unit and I get bored, or I can go and do something different. Like I saw my mom be an ER nurse for 20 something years and now she's working for big pharma. So there's just so many different opportunities. Like I came in with ER experience as an EMT in Chicago, and then I fell in love with women's health. I mean, for me, I use this like my clinicals, I found out what I don't want to do 100%. Like it definitely showed me areas of nursing that I will never be in or won't see myself in. And so it was great to find that out early on. But I have different job opportunities and offers right now in different units and different specialties, and I'm still can't decide. So you don't have to know right away, and don't get set in stone at all too. But then I have a colleague who, like I said, went into came for mental health and he's finishing mental health. So it goes both ways. Just let it flow, let it happen.
That's so true. I mean, I had no idea that I'd ever go into pediatrics, and like I'm obsessed with that specialty now. That was not in my radar at all until I did my peds rotation, and I knew that's exactly what I want to do. And also give yourself some grace, you know, like you don't have to know everything right away. You don't have to, you know, like for example, going back to that sim, it could be vSim or on-site, the directions can be really overwhelming. And it would be remiss if I didn't say that you should rely on your clinical team members. They are going to be, you know, they are there for not just as your clinical group where you show up to clinicals together. They could really be your friends, and they could really be somebody, at least one person that you can rely on. And if it weren't for my friends that I made in nursing school, I feel like I wouldn't have been successful. So, you know, have patience. You're going to get frustrated, and that's just part of the process. But something that you just have to trust, like Chantal said earlier. Yeah.
I'm basically going to put Emily's face on my nursing cap, because without Emily, I probably would not be where I am today. So definitely keep those friends close. They will get you through it 100%.
My friends are still getting me through it. Like I got like 3 people from my cohort like in the hospital. I see them and rely on them frequently. Yeah.
Yeah, for real. Like just find, even, you know, start with your clinical group, but like get a text chain going, just become friends. Don't pretend like you don't need them. Just become friends. Like instantly my clinical group, they're my rock, my ground. Like I
ride or dies.
Just do it. You're gonna be so thankful.
Can't stress that enough too though, Emily. Like I feel like I started this program, I was sitting in orientation thinking like, how am I gonna do this? This is crazy, like this is gonna be so much. And like I felt a little bit alone. Like sometimes I'm sitting and about to start an exam and I feel like, oh my gosh, this is all on me. But I have come to like learn that nursing is so much teamwork, and you are never, ever alone, ever. You always have backup, and there's always somebody to support you no matter what. And like utilizing that right off the bat will help you out so much. Like like get to know people and be open to like making those connections.
And we were able to do it over Zoom, so you guys will be able to do it if you
Yeah,
were.
like I thought I wasn't gonna meet anybody. I was mad when our program started off with COVID being on Zoom. I was like, I don't even get to be on this beautiful campus. Like our clinicals are screwed up, and I was miserable. I was awful. And I bitched a lot to Sydney, but that's why we started talking too, because we were frustrated together and like we got through it together. And things worked out in the end, but yeah.
And I would say that sociality exists when you get out there in the field too. Like, for example, if you're on the floor and something just like funky to you, you have like a whole team of nurses that you could chat with, like, hey, like, you want to check this out on my patient? Because like, this is a little weird. And I just want to make sure, like, are you seeing what I'm seeing? Are we seeing the same thing? Just know that like you're never practicing alone. Ever. There's always a team behind you. Like never feel like you're in this journey, even from school to in working in your careers. You're never alone. And if you get used to doing that while you're in school, where you can ask like, hey, like, can you just double check this for me? I think it'll be all the better for when you get out into the real world of work.
I remember when we started the program, so one of the professors had said, like, you're no longer fighting against each other to get into this program. You're now in the program and you're all towards the same goal. And that's just always stuck with me. Like, no matter what, whether you're working or in school, like none of us are trying to outdo one another. We're all in the program. We're all going towards the same goal. And at the end, like Chantal said, like you're all going to work on a floor or a unit or whatever, and there's going to be multiple nurses and you're always going to be a team. So just be a team with your classmates now.
Yeah, competitiveness at the door for sure. I'm seeing this really good question here. Do any of the courses cover the legal and current events issues of nursing? One, I will point out right now that CU has done a crazy good job at bringing in current political view. It's not just about like learning patho and meds and your assessments and all that stuff. Like CU has done a great job taking a worldview and getting you exposed to it and making you address it, especially in classes. And I mean, I'm sure we could all talk about a certain incident recently with a nurse that we are all scared and worried about, but it's always a topic to discuss, and CU is very current on that within every single class, like social determinants of health. And we talk, yeah. Does anybody else want to exaggerate on that? Because that's a really good question.
We also have student orgs that hone in on, inclusivity, diversity, and we just as student body, I feel like, do a lot of pushing from our end as much as we can to bring those important topics in highlight, in the limelight. So, CU, like Ashley said, they do a really good job, but it's also, we've formed these bodies of organizations that are run by students. It's pretty cool. And we are very much vocal about the current happenings. It may relate to nursing school, it may not. So, just something to keep in mind.
And I know sometimes this was controversial when I was a student, but IPE, actually, I loved IPE. I found immense value. I know some of us might be like, oh, these quizzes are so dumb. I don't know if they're still doing it like that, but like it was just a source of contention. But I will say it was probably one of my favorite things to participate in, because I really loved working in the interdisciplinary team and I loved talking through ethics cases. I thought that was a very important thing, and it took learning and it elevated it into this like bigger context and this bigger discussion. And I think that's something that's very unique to our program and our school. I think other programs are starting to catch on and start to integrate that, but I think that we're in a very lucky position to be on an integrative campus that we are, and to be able to have that program. So if you do feel frustrated sometimes in it with everything else going on, I would say just like there is really good value. And I think, I'm not going to speak for everybody, but for me, I learned so much from that. And some of it was like reflecting back on my experience. I'm like, yeah, that was a sweet class. Like that was really cool.
The nurses really stand out in that class
Oh,
because
yeah, we do.
we are the ones that are having clinical like right away, and a lot of like
We've done nothing.
students and PA students, they aren't. They're in their first year and they're just in didactic. So we bring a lot of ideas, and we are kind of like or what I heard and saw, we kind of start the conversations. We're kind of leading it, and it's kind of cool to see because it shows how much more like, I don't know, in the timeline we are ahead of other what am I trying to think? Words are hard. Like other groups on campus, like the PA students and doctors and dentists and everything. It's really cool to be able to work with them. And then it's just more people you get to meet and talk about like the ethics and stuff that Chantel was talking about.
But I feel like it wasn't just IPE. And when we say IPE, that's the interprofessional experience classes that you'll see on your schedules. But I feel like within each class, whether it was patho or pediatrics or like OB, we were learning about like current health issues in OB and how nursing can impact those current and global health concerns. Like you do speak a lot about how as a nurse in your future career can make an impact and also learn how to hit those topics head on, and not be afraid to be exposed to any of that, like diversity and cultural and just a really wide range of aspects, not just like meds and stuff. So sometimes it was kind of a pain in the butt to like write papers and stuff on it, but it does help.
It's like so easy out here to just put your head down and like collect a paycheck and go to work. But like nothing is like getting better in healthcare without nurses pushing for it to change and to like build those skills and build the ability to talk to other professions openly and clearly, like is like something really unique that like hopefully you can embrace it and not get caught up in like if an assignment seems petty. Like I think like they've talked to that on this chat, like they're really right about it.
But also I feel like nursing is not just about treating the health condition, it's about treating the whole person. And I think each class has like set us up to not just treat the illness, but to treat like factors that might be contributing to the patient's overall well-being too. And so being able to talk about some of those aspects within a welcoming environment to like ask those really tough questions, like why is this nurse going to prison? Like being able to have that environment to talk about with school is very helpful and makes me not so afraid to get out there in the real world.
I know we're kind of close on time, and I don't know if my advice is warranted just yet, but one of the biggest things I've learned in nursing school is advocate for your own learning. You know, not everything is perfect, and we've had situations where we've had to reach out to College of Nursing leadership. One of the things my cohort is trying to do is make learning process more easier and accessible to students, especially students of colors, especially to those whose English may not be their first language, like mine, incorporating the resources that our professors may, recommend, but that's not enough. Like they should embed those resources into our learning curriculum. So that's one of the biggest advice I could give you guys. I also have to hop off. I will leave my email address in case anybody wants to reach out. Thanks.
Thank you, Pasanad. Yeah, we are coming close on time. So I just want to take a moment and thank all of our current students and our alums for being here. We probably have time for maybe one more question, but I just want to say thanks everybody. And I'll be sending the Canvas shell link out to students later today.
And if anybody wants to email me too, I'll put it in the chat, especially about, post-grad stuff as well. Happy to answer any questions.
I'll throw my email in. I'll send my personal email just because I'm watching that more for stuff that's going on for job interviews and stuff. But send me a question. Like you don't have to be all formal. You can just act as like it's texting if you want. If something comes up a week, a month, whatever later from now, just reach out. Totally willing to help because I've been where you are.
Thank you all.
Thank you.
Good luck, you guys. This is it's gonna be a lot of fun. It's gonna be a little,
Yeah,
it's
good
gonna be
luck.
hard, but it's gonna be fun. You're gonna look back and you're gonna be like, oh my gosh, I am not the same person even 6 months ago. It is gonna be wild. You're gonna just think completely different. Like it is wild how much change and growth you're gonna have. At least that was my experience and the experience of a lot of my colleagues.
Thank you.
Thank
You
you very
guys,
much.
good luck. Reach out if you
Thanks,
need anything.
everybody.
Yeah, don't hesitate to reach out. Good luck, everyone.
Thank you.